Welcome back to Daniel Ultrasound Clinic. This is Dr. Munir Abbasi. Today we are scanning a case showing pelvic pathologies. On ultrasound of pelvis, this is uterus which appears enlarged, bulky appearance, and in the right adnexal region we are watching here. This is a right ovarian cyst showing single septum here. So this is not a simple cyst. It measures approximately how much? It appears 5.9 into 5.7 centimeters. So this is within physiological as well as pathological limits. It is showing smooth outline, no internal echoes, no solid content, but a single septum is there. So this is a complex cyst. Now let's go to the uterus. As I told you, uterus is enlarged, bulky, showing bulkiest appearance. The uterine cavity is smooth, echogenic. The cervical and body areas are obscured and being overlapped by an irregularly outlined echogenic mass in front of it, showing some areas of calcifications where from the posterior acoustic shadowing or emitting or acoustic shadowing are there. So this is an irregular echogenic mass uh, anterior to the uterus, closely abutting the uterine surface, almost indistinguishable from its anterior borders. So the lesion appears solid and containing echogenic foci. Like I told you, casting posterior acoustic shadowings suggestive of calcifications or fatty components. However, the mass appears separate from the uterus to some extent on scanning. And additionally, as I told you, there is a cyst in physiological as well as in pathological limits. Now let's go to the differential diagnosis of this mass. This is very important thing to understand and note. DD, possible DD is dermoid or mature cyst or teratoma, most likely, as I told you, showing echogenic areas with shadowings. Could it be fat, hair, or calcified elements? And could it be a pedunculated subserosal fibroid with calcifications? And the third one, DD, is usually post-surgical or organizing inflammatory mass, but there is no such history of operation. So now we have to correlate with this clinically with the pelvic MRI just to understand the diagnosis, to reach the diagnosis, and also follow-up ultrasounds are also advised. Transvaginal sonography is important. FNSC could be done here. So all these things are there. Again, I show you here is the uterus, which is enlarged moderately and showing bulky appearance. The anterior surface from the body and the cervical area all are overlapped by the echogenic complex mass, showing echogenic areas inside which are casting posterior acoustic shadowings. This is located in the left adnexal area. So DD, also I told you about the DD. Now this cyst appears multiloculated or multiseptate. There are also other septas which are appearing now with the respiratory movements of the patient. You see here. Here is the septa. So this is a complex cyst here, and this is the mass abutting the uterine anterior surface. This kind of masses usually turn out to be CAs, carcinomas. So patient has to undergo further investigations. Let us see what comes out. Thank you very much.